we forgot to set the stage for why South Asians are so predisposed to heart disease. And the reason is because of our propensity to develop that insulin resistance, which causes diabetes, elevates our triglycerides, and basically it increases our chances of developing metabolic syndrome. And so for every risk factor of heart disease, when you compare South Asians to Americans, South Asians are developing 2 or more risk factors for heart disease at a lower body weight than your average American. And that's really important because if you're held to the standard of the American BMI, you could be told that you're not overweight, when in reality you are. And that's why finding out those numbers are such a telltale sign of where you are in terms of your heart health, because finding those things out is how you actually find out if you're healthy, getting screened for blood pressure, diabetes, or high cholesterol. So that's key.
So tell me about that. There was a question about that, Sheila, about body mass index as a marker for risk. Why is it that our South Asian body type, that may not be so accurate?
Because you got to look at abdominal obesity, right? South Asians have this body type of skinny fat, but they're actually holding so much of their weight in their abdomen. That abdominal weight or visceral fat is actually causing insulin resistance. And before you know it, it's raising your chances of developing diabetes because you're not processing sugars appropriately. And so sugar is getting and the pancreas is getting burned out. And this is the early sign. And you can be fooled because you need to be measuring your waist circumference.
Yeah, and so it's not just where your weight is, it's where you deposit it. And so for you ladies out there, I'm in my scrubs. So the waist is not your jean size waist. That's not where to get the tape measure. It's not this. You want to measure at the widest part. So if this is your hip and this is the skinniest part, it's right with your belly button, okay? For those of you who are tuning in, so get your belly button and measure that, get a waist circumference as opposed to the curvature part. Specific numbers, marker for increased risk.
It cut out there. What did you say, Hafiza, or just take the question?
Is there a specific waist circumference that you would look at that would increase the risk of heart disease?
I want you to take that question because it's still not coming in correctly. You go ahead and answer it.
So those numbers are in there, but so where we keep our waist for an American man, it's 40 inches, and for an American woman, it's in the mid-30s. But for us Desis, it's in below 30. So we want to have for a Desi male under 30 as a waist circumference, and for a Desi woman 27. So not the middle part, but the part where your belly button is. So probably a more accurate measure for us compared to body mass index. So skinny but poochie belly, that apple body shape. That's what makes us insulin resistant, this tummy fat.
Okay. Excellent. Yeah, sorry about my connection there. There's a question that came in about, you mentioned prediabetes could be a warning sign for heart health. So yes, absolutely. That range of prediabetes is in your hemoglobin A1C. It begins at 5.7 and the cutoff for diabetes begins at 6.5. So when you find out these numbers, always look at your lab report, and you do have us in the community. If you need to run a number by, definitely make sure you're not just taking commentary from physicians who say, you're great. Make sure you look at that number, because if you are pre-diabetic, there's certain key things you need to know that could be sitting in your family history. Hafiza, you had gestational diabetes, and you also mentioned PCOS. PCOS is a condition that women get that predisposes you to insulin resistance as well. And sometimes the treatment for PCOS is also one of the medications that we use in diabetes. So that's why everything we're doing today is really about advocating for yourself and not leaving it in the hands of your physician, because sometimes physicians are human and they might miss something. So that's a great question about prediabetes and that warning sign. What was it like for you after gestational diabetes? How did you manage your risk?
So I had both of my sons in my 20s. So my oldest is 24 and my youngest is 20. So pregnancy is a stress on the body. It unmasks what could happen to you down in the future. So when an obese person becomes diabetic, it's because they don't have enough insulin to take care of their huge body weight, perhaps. But when a skinny person, South Asian, becomes a diabetic, it's because we are resistant to the insulin. It's not because we're morbidly obese and we don't have enough insulin for all the fat. It's because our pancreases are producing the insulin, but genetically our tissue is resistant to that insulin because it has fewer insulin receptors. So every member of my family has been a diabetic. So that's my genetic tendency. I am 5'3" and I weigh 118 pounds. And for 20 years, I've struggled with this, and carbs are my downfall. But even with 5'3" and 118 pounds, my last hemoglobin A1C was 5.8%. So it's still not normal. So this is a constant daily struggle. Exercise improves our tissue's ability to utilize insulin. So I've got exercising, not because I need to lose weight, but it helps my metabolism and my tissues be more responsive to insulin. And I've got to watch my carbs.
That's a really good visual to say to that. You know, I always tell patients, when you exercise, you actually increase the glucose receptors on the cell, and you can pull that glucose in. And I think the key here is for a lot of the women who are listening, Hafiza developed gestational diabetes at a very young age. For most women, you can see gestational diabetes later, and a lot of women are getting pregnant later, but sometimes we see it, I think, in the OB world, they're seeing it in the 30s, mid-30s. You had it very young, and specific to that because of your family history. It quadruples her risk of having a heart attack, and she's at risk for having a heart attack much younger.
Absolutely. So if any of you developed gestational diabetes during your pregnancy, every year you need to get a hemoglobin A1C checked. And a lot of times younger women, maybe when they go to their gynecologist or primary care, maybe that's not always checked. So you have to be the owner of your health.
And not just your A1C. You have to also have your cholesterol and your blood pressure. And really, really key, I just want to emphasize, in 2017, our blood pressure guidelines changed. And really, 50 million more Americans or more, right? 46% more Americans were classified as having hypertension. The cutoff has been lowered. So we've got to hold ourselves to really strict risk factor control to prevent heart disease and not become another statistic. What about, it's Saturday, right?
Preeclampsia. There was a preeclampsia.
Oh, yes. Yes. I mean, this is such a passion of mine. Preeclampsia or any hypertensive disorder in pregnancy early, even if you were told you didn't have preeclampsia, but you had high blood pressure, absolutely increases your risk of heart disease. And that's because pregnancy is a vascular phenomenon. You're growing a vascular structure in your belly. Now, if you're having high blood pressure, that means your blood vessels are stiffening. That propensity that your body demonstrated, it doesn't go away. And that's why you really need a cardiovascular specialist to monitor you, to follow you, to look at these subtleties, because it is so subtle. And we don't want the event to happen. We don't want to see the woman have a stroke or a heart attack. We want to prevent it. So you've got to catch it early and get people to change their behavior.
The other thing that I'd want to point out for any young women who are tuning in is polycystic ovary disease. I had that. And the myth is that perhaps there's a body type for polycystic ovary disease, that it would have to be somebody more overweight. But there are thinner people with polycystic ovary disease. I had horrible acne. I had hirsutism. Thank God for laser hair removal. More above and beyond what we Desi girls have. I had more. So I was a skinny PCOS. And then when I got pregnant with the gestational diabetes and the pre-diabetes, so I was a setup for where I am now, from the PCOS to the gestational diabetes to the pre-diabetes. So, and in terms of gestational diabetes, South Asian women tend to have it more than white women. South Asian women, Hispanics, and have more gestational diabetes and more polycystic ovary disease as well.
So one of the things I wanted to touch on is, it's Saturday, and South Asians are very community-based, we're very family-oriented, and I think we should impart some strategies that we've done in our own life to make our South Asian family dynamic more healthy. Hafiza, why don't you start?
Well, number one, I think our lifestyle can be very sedentary. We're studying and working. I'm studying and working. And we need to pencil in time for moving our bodies. I feel like we sit a lot. I feel like our parents sit a lot. And strolling, the stereotype of going for the evening walk with the arms behind our back, our parents, going for a stroll. That's good, but it requires just a little bit more. So encouraging our children to exercise, we focus on studying.
Focus on studying.
On tutoring, but we've got to get our kids out there, and we need to be there with them on the soccer field, with our spouses, encourage our parents to move as well.
I think that's absolutely key, is really emphasizing how dangerous being sedentary is. But of course, you have to do it with love, because to change culture, right, you have to lead by getting major stakeholder buy-in. And so you've got to find a way to get everybody engaged. And I think one of the best ways to do that is to start making active family hangouts. My husband and I are very active, and we've incorporated, putting an activity in to begin an event that's, going to have a lot of food and sitting. But it's important to kind of lead with, let's do something with movement, and let's also try to get that movement in at the end of the meal, because sedentary lifestyle has been shown to increase your risk of having a heart attack and event. And what if we told you that if you moved more, you could prevent that event? What if and that is what we're going to tell you a lot more of in the next hour. And that's really key in changing the tone of your family, especially if you guys like games. Get up every now and then and just stretch and move. A little bit goes a long way, because that's what the U.S. Preventive Physical Activity Guidelines showed us most recently when they were updated in 2018. Yes, exercise is great, and we want you to commit to a certain time every day for a certain period of time for the entire week. But even the cumulative effect of exercise has a dramatic benefit in reducing your cardiovascular risk. So help your family members understand that. Help them incorporate it and change their lifestyle. Take that stroll up a notch, get their heart rate up, and really help them reduce their risk.
Yeah, and we'll answer those questions about the algae oil and ghee in our next session. So we'll start that in a couple of minutes. But, get for your parents, for your mom and your dad, we talk about 10,000 steps. But for our mothers and our grandmothers and our aunties, the benefit in risk reduction of cardiovascular mortality reduction starts at 3,000 steps. So if your mom or your aunt, they feel like 10,000 is unachievable, understand that the benefit starts at 3,000. So drag them with you. Our family is at the core of our South Asian life. So, incorporate them. If you're lucky enough to be living near your parents, incorporate them and let them know that if 10,000 seems unattainable, 3,000 is a great place to start.
Such a great tip. Other things that I think are really easy to do that I tell my patients that we can all tell our family members: park away from the entrance to the grocery store. We all love food shopping, I'm sure. We all love cooking, maybe, maybe not, but we're running errands all the time and we're busy people. And if you can steal those moments to get that movement in, do it. If you can encourage your parents to wear sneakers when they exercise so that they really can get that, they can set their self up for success. That's really, really important. It is true to be mindful of arthritis, mindful of any injuries people could be going through, but then remember that there are other things that can help reduce your cardiovascular risk, such as stretching, lightweight training, even deep meditation and breathing with all the movement of the diaphragm. That can also help reduce blood pressure and reduce your risk. So let's really celebrate small changes that can make the whole lifestyle more healthy.
Absolutely, and we'll discuss this in the next session, but hey, we invented yoga. We invented meditation. This is our thing. How did it become appropriated, and then we're just sitting there wondering why our knees are stiff? So if you have a parent or a mom whose hip or knee hurts, remember, 1 pound of weight loss is 4 pounds off of that knee. 1 pound of weight loss is 4 pounds of pressure off your mom's knee or your aunt's knee or your grandmother's knee. So even if we can encourage them to do a little bit of weight, it's a lot of pressure off of their joints. So things get stiff because we don't use them. We need to use them. Every part of our body, every part of our muscle, our brains, use it or lose it. So, there are no rules. It's simple common sense. And people want to make it fancy to sell you something because make it complicated so that you'll buy it and that you can't do it yourself. Sheila, isn't it it's basic, isn't it?
I can't even hold back how excited I am. It's so true. I mean, you're hearing it from two cardiologists. You're hearing it from two Desi women. It's so much easier than mainstream media makes it out to be. It's so simple. And every little bit of change you make, every little pinch less of salt, every little movement, putting on the sneakers, putting on some music, doing some Bollywood dancing after a meal, all of this has the most incredible additive benefit to make the whole family healthier. So hold on to what you can do, celebrate those wins, and stay committed to it.
Absolutely. It doesn't have to be that every workout doesn't have to be some 45-minute high-intensity session. Like, oh, what difference does it make? Because I'm not going to be able to get a 45-minute workout in. But 3 10-minute workouts are good. So everything doesn't have to be some big goal. Celebrate the little goals. And just remember that food heals us. So eating processed food all day and then taking a turmeric supplement, a garlic supplement, a vitamin E supplement, ashwagandha, and 5 other things, how is that going to neutralize the 15 different weird chemical names in that boxed item that you just ate? That doesn't make sense, my friends.